Hey guys, welcome back for Dr. Nickels' 2 cents. I really have 5 cents to speak about, but I guess we have to go with the 2 cents. Today, I'm going to talk about something that my friend Dr. Bill Davis posted, and it was about oatmeal. So I have patients that, we go through dietary history and, they ate their oatmeal. They swear the oatmeal has helped with a lot of things from a, lipid management standpoint, but also a bowel movement regularity standpoint. And so Dr. Davis talked about, the truth about oats and oatmeal. And so, yes, the heart healthy claims have shown that eating oatmeal can reduce LDL cholesterol and total cholesterol, okay? And that's because of the beta-glucan fiber in there. So that slows the glycemic response of the sugar on blood. What you don't know is that we don't know if it reduces the small LDL particles, which are the ones that cause hardening of the arteries, and those are the ones that oxidize, okay? And I would think that they would actually be increased, not decreased, okay? So when we're looking at calculated LDL and calculated total cholesterol, yeah, we might see those levels come down, but cardiovascular risk is probably increased, okay? So, we think of, okay, oatmeal is gluten-free, this is great, Dr. Davis talks about, avoiding, gluten. At the end of the day, a lot of it is just for the fact of getting rid of a lot of your carbohydrates and grains in your diet anyways. So ultimately, the biggest problem with oats is the high content of the super carbohydrate amylopectin A. And this is what is responsible for causing blood sugar to significantly rise after eating oatmeal. And, I ask patients all the time, how do they feel after eating oatmeal? And I would say probably over 50% of people say that they get tired. And you would think, wow, it sticks to your guts and, gives you, this fiber and all that stuff. But what they've shown clinically is that people that don't have type 2 diabetes, after about 30 minutes to 60 minutes after eating a bowl of oatmeal that has no added sugar, no fruit, no taste, their blood sugars rise to about 150 to 180. 30 to 60 minutes after eating regular oatmeal. Now, most people aren't eating just plain oatmeal. They're going to add fruit and stuff like that, so that's going to add even a higher glycemic response. People that have insulin resistance type 2 diabetes, their blood sugar can increase, 30 to 60 minutes after eating oatmeal to 200 to 350. So that's very significant. Now, most people are not checking their blood sugars, even if they are type 2 diabetic, an hour or 30 minutes to an hour after eating something. So if you want to do a little experiment on yourself, eat some oatmeal, plain, no taste, and check your blood sugar, a half hour to an hour after and see what happens. And I'm sure it will, significantly increase. You look at, a standard serving size for oatmeal, which might be a half a cup. Most people are eating way more than that. And you're looking at about, 35 grams of carbohydrates. Well, from a grain standpoint, that's way too much. But a lot of times people like to reduce the amount of carbohydrates from a totality standpoint, 35 grams or under. So one meal is essentially going way over that. There are other issues, though, with oatmeal that we kind of forget. So one, there's a lot of fungal contamination with oats. And so fungus is not the issue. It's a lot of the mycotoxins that can cause different carcinogenic properties, liver toxicity, neurotoxicity issues. There's also a correlation to oatmeal consumption associated with type 1 diabetes in children. So we think we're giving our kids a good breakfast, this will, again, kind of hold them over for a long time. Well, we're not looking at the gliadin protein anymore. We are actually looking at the avenin protein. And essentially, this is very similar to the gliadin protein, and this can increase risk of type 1 autoimmune diabetes and the destruction of the pancreatic beta cells, which is what produces insulin. So is that a correlation to, why we see, a higher incidence of type 1 diabetes in kids? And there's also issues from a skin standpoint with the oatmeal. And in oats, there's phytates in there that bind to minerals such as calcium, iron, zinc, magnesium, causing malabsorption. And I see a lot of deficiencies, mineral deficiencies in people. Is it because of their oatmeal? So at the end of the day, we want people to focus on eating, well, one, eating when they're hungry, two, eating low glycemic, non-grain foods, really focusing on increasing fats, not only to help with brain health, but also lipid management. And we can definitely thank our good friend, Dr. Bill Davis, about this awesome information. And if you have any questions, definitely look on Facebook, send that to me, and we'll definitely answer that. So no oatmeal for breakfast, or I guess anytime. All right, guys, till next time, take care.